Hi there, my name is Kristal Woodruff, and this is the Nova Southeastern University Video Essay Questions 2018-2019 for the Department of Occupational Therapy. My N number is N019-65248. I first want to say thank you for giving me this opportunity, and I look forward to hearing from you soon. So let's get started. So number 1, why did you want to become an occupational therapist? How did you first become aware or interested in OT? I've dedicated most of my life to helping others by learning, practicing, and teaching massage. Becoming an occupational therapist will allow me to continue to progress as a person, a professional, and a helper. My desire of helping others have grown to include veterans, something I hold very dear to me. Occupational therapy seems like the logical progression. I've been a massage therapist for 17 years, and I've used several occupational therapy techniques in my practice. As a child, my mother was disabled. Among other things, her eyesight was continually diminishing as a result of macular degeneration and a detached retina. In an effort to help my mother move around the house more efficiently, I created devices like bells and sound strips and places, and I taught her how to listen when pouring and how to use her fingers to tell her when a glass was full. Prior to 2013, I always felt like I had a passing knowledge of basic occupational therapy methods. Then during the summer of that year, my nephew had an accident that left him paralyzed. As a result, he received intensive inpatient and outpatient OT, and I was astonished by the results, and I was inspired to learn more. Number 2, in your view, how is occupational therapy different from physical therapy? From my point of view, the roles of occupational therapy and physical therapy are necessary forms of restorative health care in today's society. The goal of PT is to restore function and mobility through the use of exercise and strength conditioning. Physical therapists typically focus on anatomical injuries. Occupational therapy, which grew as a profession from more injuries from World War I, occupational therapy focuses on providing basic human needs, the activities of daily living, as a therapeutic practice. I believe that occupational therapy is one of the most holistic healthcare professions by incorporating alternative therapies such as massage, lymphedema therapy, equine therapy, and others. I also see occupational therapy as more of a hands-on profession, and I believe the power of touch is as necessary as it is therapeutic. Number 3. Why do you want to get a doctoral degree when the current entry-level requirement is a master's? Personally, it wasn't a matter of master's versus doctorate. I chose Nova's program for its philosophy. I read a forum on the AOT website, and just something struck me. A higher degree equates higher skill and knowledge within the profession, the medical field, and patients. With the designation of doctor, this offers an added bonus, which shall allow me to supervise enlisted and other qualified occupational therapists, as well as serve as commander of companies and medical treatment facilities in our military. Number 4. Where do you see yourself 10 years from now? How do you see the NOVA OTD program as helping you achieve these goals? After obtaining a degree from NOVA, my career as an OTD will be something that has become a way of life. I will be a captain in the United States Army. As a member of the Army Medical Corps, I will provide direct care, training, and wellness education to our soldiers. I do not think that this would be possible without the leadership component this program has to offer. With advanced skills in injuries and rehab from the multiple learning experiences from NOVA, I will be able to provide individual treatment to soldiers suffering the effects of acute and chronic combat injuries and operational stress. I wholeheartedly believe that we must protect and treat those who protect us. We should take care of the needs of the ones who serve. Number 5. What do you know about Tampa's entry-level doctorate program? What are your reasons for wanting to attend this program versus other programs? It is a research university, which means it's always growing and changing. Innovative people of all ages attend NOVA, and as a non-traditional student, I appreciate the diversity this university incorporates. The hybrid format is appealing to me as it accommodates to individuals with a busy work and family life. The numerous practice settings and leadership skills NOVA offers will greatly benefit me in achieving my goal of becoming a commissioned officer and Doctor of OT in the U.S. military. And when I attend class, it will be in sunny Florida. Number 6. Please describe your experiences with online learning. What do you think it takes to be successful when attending online classes? I took several of my undergraduate courses online. As a licensed massage therapist for 17 years, I've taken several online courses as well to maintain licensure. To be successful, I have found that you must be self-motivated, well-organized, and the ability to complete tasks without a lot of remedial instruction. Number 7. What does the phrase taking responsibility for your own learning mean to you? Taking responsibility for your own learning allows for a greater sense of pride in your hard work and new skills. You must be willing to identify your strength and weakness in order to work on the area in which you need most help while building those necessary skills to be more successful. Being able to manage your studies outside the classroom will help to develop independence and the ability to be flexible in stressful situations. Number 8. Describe why cultural diversity and cultural competence is an important consideration in the field of OT. Cultural diversity is the acceptance of the fact that the world is filled with a vast array of people with different backgrounds, beliefs, ideas, and even desires. Competence is the ability to understand these differences to a degree, at least in such a way as to be capable of working with individuals' differences in order to better accommodate their specific needs. Understanding and accommodation is essential when working with clients from diverse backgrounds. Number 9. Scenario 1. After taking a very hard exam, you find several of the classmates received a copy of the exam ahead of time and did very well. The rest of the class failed the exam, including you. The instructor informs the class that she will not curve the exam because of students who did so well. What do you do? This scenario actually happened to me during my summer semester as undergraduate. I felt that the right thing to do was inform the professor of what I had seen, only to find out that I was not the only one to report the issue. I believe that reporting this to help the students who were required to take a different exam to grow in terms of responsibility and accountability. I also believe it may have helped the professor grow as well, as she was more attentive during test times. Number 10. Scenario 2. You're working in an outpatient clinic and a client of yours who has had hand surgery is not making good progress. Her surgeon has a poor reputation in the clinic. One day the client says to you, "I don't feel like I'm getting better. Is my surgeon any good?" What do you consider in attempting to resolve this ethical dilemma, and what would you say or do? As I'm ethically bound to do no harm and to help my clients, I would inform her that I am not capable of making an assessment of the surgeon's abilities. I would help her in any way that I could within my capacity as an occupational therapist. If she still failed to progress or felt that there was a need, I would encourage her to seek a second opinion. Number 11. Describe your strength and identify areas in which you need to grow. I have a strong ability to overcome adversity and passionately follow through with my goals. Throughout the course of my undergraduate studies, I gave birth to and cared for 2 daughters. I lost my mother, ran a business, and still graduated cum laude. Difficult as it was at times, I believe you have to do what you have to do in order to finish what you started. An area in which I need to grow is to not take things so personally. Often I wear my heart on my sleeve. I've discovered a quote and tried to adopt it in my practice. Have a mind that is open to everything and attached to nothing. The quote is from Dr. Wayne Dyer, and to me it just stuck with me. This is not to be attached to negativity. Be aware of everything, just don't absorb it. It's something that I'm working on. Number 12. There are a number of applicants waiting to be interviewed. Why should we take you? I'm somebody that has already dedicated half their life to helping others, and I have the desire and determination to achieve my goals no matter what life throws at me. I'm not only experienced, I also have a desire to grow and learn in order to continue to help others. I'm grounded in my life as a wife, a mother, and a business owner, and I have a desire and passion to be an occupational therapist. Thank you for your time and consideration for the program, and I look forward to hearing back from you. Thank you so much.